this edition of the IIMCreate, the IIM Calcutta Center for Entrepreneurship and Innovation channel that celebrates the success of IIM Calcutta alumni in the entrepreneurial space. I am Professor Balram Avittattur, who is the coordinator of this center. It is our pleasure to welcome Mr. Thulasiraj Ravilla as the guest in this episode. Mr. Thulasiraj Ravilla is the Executive Director of LAICO Aravind Eye Care system. He is an MBA alumnus of our institute and graduated in 1973. After 8 years in industry, he joined Aravind Eye Hospital in 1981 to lead the administration as a member of its startup leadership team. Aravind Eye Hospitals now annually handle 4.5 million outpatient visits and perform over 500,000 surgeries and other interventions. Over half of these patients receive care either free or steeply subsidized rates through internal financing. In 1992, he co-founded LAIM's Aravind Institute of Community Ophthalmology, which has mentored over 360 hospitals in India and imparted management training to over 2,600 eye care professionals from across the globe. Mr. Thulasiraj has been actively involved in several research activities, both clinical and operations research. He has authored or co-authored over 100 articles in peer-reviewed publications, written book chapters, and presented papers in several national and international forums. He has been an advisor on several national and international bodies. He was IAPB's Southeast Asia's regional chair and was founder president of Vision 2020 India. He is or has been on the board of Orolab, Acumen Fund, Dunn Foundation, Seva Foundation, as well as Indian Institute of Management, Calcutta. His recognitions, I am reading out a few of them. Mr. Thulasiraj was named a social entrepreneur in May 2005 by the Square Foundation of World Economic Forum and has been invited to attend the WF at Davos, Switzerland over several years. He was adjudged as the Administrator of the Year in 2008 by Modern Medicare and GE Health. The Chinese Ophthalmological Society, in recognition of the support to the prevention of blindness in China, awarded him the International Gold Award for the year 2009. He was invited as a speaker at the TED conference in 2009, and he has been listed among the 30 most influential people in public health globally and recognized as the most inspiring healthcare leader of the year by Times of India, both in 2014. He was also honored, very importantly, he was also honored as the distinguished alumnus of IIM Calcutta in 2018. With me, I have Dr. Shubhranshu Sanyal, the CEO of IIMCIP, and Jaideep Saindem, who is the president of the IIM Calcutta E-Cell, which is one of the prominent student clubs in the institute. So let me start off with the first question. Mr. Thulasiraj, could you please describe the journey of Aravind Eye Care as world leader in eye care? What has been described as a fantastic example of the bottom of the pyramid concept by the late Dr. C.K. Prahlad, the reasons for its business success, and the various innovations associated with this organization, as well as LAICO.
Thank you, Balram. It's a very, very special honor for me to be part of this series of interviews, for IIM Calcutta that I cherish a lot. About the journey of Aravind, it all began in 1976 when the founder, Dr. G. Venkataswamy, retired from the government service but wanted to continue his work. And that's how the journey began. And so as an organization, we did not have any financial backing or an industrial donor, or so it started small. It started in a rented house, which had 4 bedrooms, converted into 10 or 11 beds. And then that's how the hospital began its journey. But I think what has probably got us to where we are now, I think today we are a pretty large network, mainly in Tamil Nadu, and I'll tell you why the reason. We are now 7 large hospitals, and each hospital would see between 1,000 to 2,000 plus patients. We have 7 smaller hospitals, and then overall more than 100, I think 101 clinics in the communities. Some of them are run by doctors, and the rest are by technicians. So we have a pretty extensive footprint covering all of Tamil Nadu, Pondicherry, as well as one hospital in Andhra Pradesh in Tirupati. And I think what made this possible is just looking back, the design of how we went about it. As we normally teach in management, for an organization to scale, one has to pay equal attention to the demand side and the supply side. You got to kind of find the right balance to keep them both going in sync. And then with us, when it comes to hospitals, it is less common that the doctors at the hospital, the providers, pay attention on the demand side. Some might do some advertising, but by and large, most hospitals treat those who come to them. In our case, we certainly did that, and we made sure that those who came to us got good care and were happy and had good outcomes. But then we went one step further, because we recognized that for every patient who kind of accessed care in the hospital, there are possibly 5 to 10 people who would benefit but were not accessing care for whatever reason. So we were aware of that intuitively, and of course later on many studies demonstrated that. So right from day one, we had a process of reaching out into the community. Initially it was by doing eye camps for the first 25 odd years. That was the only approach that we had. And then we also, it is not only reaching out to what we call as the non-customers, but we also went one step further to recognize what other challenges they may have in accessing care. And then we owned those challenges of the community. So with the result, way back in 80, 81, a model emerged that we would go out to the community to do outreach. And because we recognize that most patients are not able to come to the hospital on their own for surgery, we provided free transportation in addition to free surgery, food for the 1 week or so that they would be in the hospital. So we basically removed all the barriers, both economic as well as social, because by bringing them to the hospital and taking them back, the dependence on the family members to escort them was not there. So all of this kind of made the demand very robust. And we also recognized that more we worked with the poor, or the ones who did not have the financial means to pay for the services, it was doing something in the community, in the or you call it as marketplace, in terms of building trust. And because these patients who were blind, when they go back, they're able to see very well. So the word started getting around, and as a result, we started also getting a lot of paying patients. So that was one part of it, being building the demand side. And then in the hospital also, we designed it so that we made it like, say, in terms of access, where patient did not have the means to pay, they can choose not to pay. In the sense, they go to the free section where everything is free, all the consultation and all of that, they don't have to pay anything. So empowering the patient in that sense, now by the design of services in the hospital, again helped quite a lot. And then in almost in all our thinking, we seem to have taken the customer perspective, or in our case, the patient perspective. So for instance, your patient can come and get care in the hospital without having to make any appointments. So it is completely walk-in, and we on the back end we do the resourcing and the operations and everything to make sure that we're able to deal with a patient in about 90 to 120 minutes. And then we also try and complete all the investigations, diagnosis, and if applicable, the treatment as well on a single visit. Basically trying to minimize the cost for the patient. So all these approaches, I think, probably appealed a lot to the community, because it was all done with the customer or the patient in mind, which continually increased the demand for the services. So as the demand kept growing, we kept building more and more hospitals, and then we also built the HR pipeline for staffing them. And that's been, in a nutshell, the key strategies that made us grow. So I'll stop here so that we can explore whatever is more interesting. Yeah.
Thank you. Shubhranshu will now.
Yeah.
Thank
you, Mr. Thulasiraj, for sharing the journey of Aravind Eye Care. You know that IIM Calcutta has this innovation park which supports entrepreneurs, and we have a strong focus on social entrepreneurship. So the social entrepreneurs are trying to solve major challenges in our society by leveraging technology. So these entrepreneurs, social entrepreneurs, they are all very much inspired with the case study of Aravind Eye Care. And since you are in the founding team of Aravind Eye Care, the model that is a case study, they'll be very interested to learn about your personal journey. That why did you take it up? What was your motivation behind taking it up? And I'm sure this journey was not smooth. There were lots of challenges, and you are always in a problem-solving mode in solving those challenges with innovation, and going ahead and finally building a scalable and sustainable social enterprise. So may I request you to share about your with the entrepreneurs about your journey, and I can tell you that will be of great motivation to the entrepreneurs.
Okay. Yeah. This is going to be it can be a very long answer, but I'll try to be brief on this. So I, soon after graduating from IIM Cal, which was in 1973, I got a campus placement with British Paints. Now it's Berger Paints, and I was with them till 81. But sometime in 79, 80, there was a little bit of an internal quest about, what am I doing, kind of a question, because within British Paints, I had a very good innings. I did very well, was well respected, and I was definitely on a path of climbing the corporate ladder. All of that was there. But then I also realized that beyond the first 5 or 6 years, I really wasn't learning a whole lot or doing something that was really different. It was essentially more of the same. And that is when this opportunity, Aravind started, and they were looking for someone to help with the administration management, and the feelers were coming in. So that's when I was contemplating that. So at some point I did take the decision, and then I actually gave British Paints literally a 1-year notice, not a 1-month notice, because I was holding a key role of managing the entire information system and systems in general. Even though I gave a year's notice to Berger Paints, British Paints, part of the decision was also made out of ignorance, in the sense I had no real training or background or experience in healthcare or public health or in running hospitals. So that was also an important factor. And I'm mentioning the notion of ignorance because that's what social entrepreneurs or any entrepreneur. We normally are treading uncharted waters. So there's always this element of unknown, which I think we'll have to embrace. And then work with it as we go along, which is something that I also had to do. And there were also issues around salaries and all of that, because as joining a social enterprise, the salary was not what British Paints was paying me then. So there was a significant reduction in the salaries. But then when I applied the reverse logic in terms of what am I saving in Calcutta, which was literally zilch. I was not saving anything at the end of the month. And I knew that would be the same in Madurai as well when I joined Aravind. So all of that went through. There was a bit of a family discussion, all of that. It all worked out. So when I joined Aravind, it was quite early when the hospital started. So that's why I'm still considered to be part of the startup team. And in that journey, we had lots of challenges. So I'll restrict myself largely to some of the challenges that I was more directly connected with, and I'll also touch upon a few organizational challenges as well. So as I started as the administrator, this was at a time when almost no hospitals had this concept of having an administrator running the hospital. Now, typically in India, even today, it is the doctors who run the hospitals, and they may have some people who will take orders and do what it is. But then our founder had the foresight that this has got to be a discipline which should have equal importance. And then there was no role model or anything to kind of go by. So I defined my role as making sure that the clinical team can do their work more efficiently. So anything which is not clinical, they shouldn't have to worry about in terms of equipment being working, enough patients being there, that's a demand, the staff coming on time, the place being kept clean, security, everything A to Z, which is required for good care to be given. I took that as a role of administration. And I also defined my role to be subordinate to the caregiving process, because the goal of the hospital is patient care. And I saw administration as a enabling part of it. So that's how I define. So with that, as I built systems, processes for the hospitals to function, billing system, inventory system, maintenance and outreach and all of those things, the work itself became more, and we're also growing very fast, as an institution. From starting with very little, and we were more than doubling every year. So clinical staffing, all that was happening because there was a necessity. But then when it came to administration, I just couldn't get another administrator to work for me. Somebody who can be a self-starter, who can kind of not really follow instructions, but who can initiate and improve things. I just couldn't find. I tried employing MBAs from the local business schools, and then their time in Aravind was a matter of a few months. So it was always coming back to square zero. So one of the things that I did after about 7 or 8 years after joining was recognizing that India had no training in hospital management or in health management at that point of time. So I mooted the idea of starting a master's course in hospital management. Then spoke with the local vice chancellor of the Madurai Kamaraj University, who at the time was a very progressive vice chancellor, and then he really embraced the idea. So we started within the MBA department, the very first hospital management program, master's program in the country. with an intake of about, I think, 15, 20 students. And that was a kind of a game changer in the scenario of hospital healthcare management. Now, because then I could admit, I think the deal that we had with the university was that saying that they would teach, we developed the curriculum fully, and we said that you teach the core management, finance, inventory, HR, a few of those things, and we said we will teach the entire hospital healthcare related stuff. And I had faculty coming from Michigan and in other places, so it is a pretty good course that we did. So in a couple of years' time, I had half a dozen really competent managers, to support me, whom I had sponsored from within Aravind for the course for the first couple of batches. So that was very helpful, and then that kind of gave me a much higher bandwidth to go through. So within Aravind, this ethos was very prevalent, in terms of if there is a problem, you figure out how to solve that. So that led to a lot of innovations and new developments. Like another organization challenge that we had was there were training programs for ophthalmologists, but then there was nothing in the country which would train the support staff, the clinical support staff who can help an ophthalmologist. There were nurses, but nurses were next to useless when it comes to providing eye care, because this required very different kind of assessments and techniques and assisting in surgery, which was, I think overlap was extremely small. So even if you took a nurse, we would have to train her or him for at least 18 months to 2 years. So we took the route of going to the villages and recruiting high school girls and putting them through a 2 years training, which initially was learning through osmosis or by working, and then later on it developed into a much more robust and very structured 2-year training program. And that program has grown. Today, each year we recruit about 500 to 600 rural girls, high school girls who undergo 2 years training, and they work for us for about 3 years, and then they move on with their life, marriage, and family, and so on. Some stay on, so that's been something which has been greatly appreciated. And within Aravind, that's the cadre which really has brought in a lot of efficiency and quality into the system. Now, because they take care of everything that a doctor does not need to do on the clinical side. Now, and we define that anything that is repetitive, which doesn't require judgment, which requires just measurement, like checking vision, measuring eye pressure or hypertension, or taking a photograph or an image or an ultrasound. And they're all repetitive skill-based tasks, which take time to do, and they're all essential for delivering good care. So these young girls do that work. They do that day in and day out. So they're very efficient in doing it, and they do it very, very high quality. Now, as a combination of this, our doctors became extremely productive. So that's another piece of our puzzle, because we early on made the decision that we will turn no one away because they cannot pay. With the result, in the early years, almost 70% of our patients were not able to pay, and they got free care. But then we also made a counter decision that we will not raise donations for supporting this. Because with donation, there's a lot of uncertainty. So we said we will do this with earned income, which really meant we had to, with the earned income, the challenge was that the price is set. The price is what the market has. So we could charge what the market rates were, but we had to, we could make our margins go up by reducing costs. And I think it is this cadre of staff that came in that helped us. Because typically an Aravind ophthalmologist is 4 or 5 times more productive than an outside of Aravind, if you compare to India. So that dramatically brought down our costs and increased our margins, which helped us to pay for the free cases on our own. So we had these kind of challenges, some of which were self-imposed challenges, like not going in for raising donations. And in hindsight, all of these have helped us enormously. So I'll probably pause here.
Sure, sir. Thanks a lot.
Yeah, thank you, Mr. Thulasiraj. I think it was quite interesting, and you have elaborated the challenges you faced or the problems you faced every step, and how through innovation, either in the process or in the model, you solved it and created a efficient overall business process. Thank you for that. I'll now request Jaideep to take over.
Thank you, sir. So, yeah, sir. So my next question is about that. Today we see many young entrepreneurs who are moving to social entrepreneurship, and there are many more who are passionate about making a difference and contributing to this domain. So what would be your advice for these young entrepreneurs to enter the social entrepreneurship domain?
Okay. So thanks, Jaideep. You use the word passion, and I think that's probably the most important ingredient for anyone entering into the social entrepreneurship space. And then the first advice would be to recognize that they have to be in it for the long haul, almost committing their life, that sort of a thing, because that's how long it takes. Now, because there's a very fundamental difference between a regular entrepreneur and a social entrepreneur. Because a social entrepreneur is committed to making a difference in the society. While today all of us know most entrepreneurs' dream is a takeover by Google or Microsoft or whatever. No, they're not committed to their idea. No, they work on an idea and hoping that somebody big will take them over with big money so they can move on to something else. Some of them become serial entrepreneurs. So the motivation there is very different. So that is, I think, one fundamental difference, that to recognize that you are here in the long haul. And the second part is to recognize that when it comes to building a social enterprise, it requires at one level the usual stuff of funding, processes, structure, and all that. But I think there has got to be a very heavy dose of a value framework. Because I have thought about this quite a bit, and I think it's very difficult to separate out social enterprise from underlying value framework, because that becomes very, very fundamental. The way you build a social enterprise has got to be almost 100% non-exploitative. Now, while in any entrepreneurial model, I think that probably forms the foundation of building. You exploit a situation. So in a social enterprise, I think you just do the counter. So you need that energy of a value framework to guide you and keep you on the right track. And the third element is that the notion of scaling is very critical. So people because we have a good formula, in the sense when we build a hospital, we cater both to the poor and to those who can pay. And then the way we do it, every hospital is financially viable. So we've had countless offers in the course of the last 4+ decades of people saying, we'll give you $100 million. Now, why don't you scale up across the country? wanting to scale up into Africa. We've had people reaching out from the US, from other venture capitalists saying that because financially we are very viable. We are very strong with an EBITDA of almost 30-35% even after the free work. But then we fully recognize that while we can scale physical infrastructure, buy equipment, build buildings with money, we cannot scale by throwing money the ethos of the organization, which is all brought in by the people. So when it comes to scaling, I think people in social enterprise have to recognize a delicate balance of because sometimes the social problem is big enough to want this scaling. But then if people go the route of a typical entrepreneur of raising capital and then and scaling very rapidly, they are likely to start facing issues that come into conflict between the passion, the purpose, and the values or the means by which it is done. Now, this will become very obvious quite soon, and anyone who is investing money will want to exit. And then the pressure on the money will become more important than solving the social problem or the passion with which you came into this. So it's a very different kind of a ball game. And again, I'll just stop with one more advice for someone who's getting into the social enterprise space. There, I think, as long as you have clarity on the purpose, is to say it may be educating children and making sure that every kid gets good education, or like we are doing, eye care for everyone. So you have that kind of a goal, and you recognize that the problem is much, much bigger than what you can solve by yourself. Because such need exists across India, across other developing countries. So there is almost endless need to do it in a number of the social challenges. So the notion of what I would say, recognizing that you don't have to become the sole provider. No, you don't have to aspire to become the Microsoft or Starbucks of that social enterprise. So I think that's very critical, because you can achieve that social goal by enabling many others like you to do that. And that is a decision we took right in the beginning, saying that we will do what we can in our backyard and we'll grow organically as based on the demand and our capacity to build value-based HR. And that's what has brought us to where we are now, and we continue to grow. We'll be adding another couple of million square foot of space in terms of expansion and new hospitals coming up in the next couple of years. So we are growing at a fairly good pace, but then with that framework. But what we have done, I think, quite well is that we have completely shared our knowledge and IP to another 350, 360 hospitals, and the list is continuing to grow. So when I say we share our IP, we share everything. The clinical protocols, the forms that we use, the software, some of it there is a fee just to cover the cost. The training, somebody will want our salary structure, somebody will want our fee structure, somebody will want our forms that we use for different things. So whatever they ask for is given, and anybody in the organization will give it. They will not say, I have to ask the director's permission. So with this, we have these 350 odd hospitals, which have more than doubled their output, through following best practices with some mentoring, training, and all of that. So that sharing and enabling others, the delta or the incremental work that they do after engaging with us is more than twice what Aravind does. So to that extent, we are closer to the purpose. So this, I think, applies to every social enterprise. So I think cultivating that ethos of sharing, and building, and then you sort of make this into a movement, rather than as something that I'm doing. I think recognition will come. You don't have to. I think it comes much more readily when you are sharing and giving, rather than holding it to your chest and not dealing with it. So I think these are some of the high level, completely from my experience, is what I think would help somebody starting that journey in the social entrepreneurship.
Thanks a lot, sir. It definitely makes sense that it's not just about the capital, or not just about the output that you generate, but also about the value system that you have and the passion with which you start your enterprise. So thanks a lot for the advice, and I believe that a lot of social entrepreneurship entrepreneurs would definitely benefit from your advice. So we definitely have seen that in the pandemic times, the healthcare sector has been tested to its limits. And we have seen that there is also an accelerated innovation in this sector. So what, according to you, are the challenges and opportunities that you see in the healthcare sector in this post-pandemic area? What does the future of healthcare look like? And how can new startups leverage this environment to create innovative offerings in this sector?
So one of the biggest lessons or learning from the pandemic is the impact of access. Because the very first thing that was done when the pandemic was declared was a lockdown. People said you just can't go anywhere, and other than for medical emergencies. So and even there was a lot of, you had to get a e-pass, and so the access became a challenge. So for healthcare, access has always been a challenge. Because if you look at people who are not getting the care that they want, especially even emergency care, and even more if it comes to kind of elective care, access seems to play a huge role. So urban people are better served than rural people. So and then there are enough and more evidence of that happening. So what the pandemic did was to really accentuate that particular thing. So going forward, I think given the pandemic itself has given us a lot of stimulus to work around this access issue. So that I would say is going to be throwing up a lot of opportunities for innovators if they want to go to that route. And things like telemedicine, all of that is popping up. In fact, we within Aravind had worked on access as far back as in 2004. Now, when we established the very first telemedicine-enabled primary eye care center. And today we have close to 100 of them. So that was to address the access issue. And once we did that, we now can more or less say that we are providing universal eye health. So I think there's going to be a lot of opportunities of addressing the access space through technology and things like that. I think telemedicine is maturing quite rapidly, in this space. But for telemedicine to become much more relevant and robust and effective, it also requires a lot of information. Some of it could be existing information, and for that we have solutions that are very rapidly already there. Electronic medical records on the cloud, so which one can access from anywhere at any time. But the other one is data on the patient's current status. So that's an area where I think already a lot of developments are happening. remote ECGs and stethoscopes, and now we have, in eye care, we have visual acuity measurement. A lot of cell phones now can take, they all can take photographs, but now with some attachment, it can take specialized photograph of inside the eye, the retina, and all of those things. So all of those things are opportunities that are now emerging in this context of this thing. And again, the general opportunity I would say is that now the patient is a lot more digital savvy. I think the proliferation of smartphones is increasing very rapidly. And I just read in the newspaper that Google and Reliance are going to launch their new phone, I think 2 days from now on Diwali Day. I don't know about the pricing, but if it's really affordable, that will further accelerate this process. Now, with that, I think a lot of other opportunities also come in. So in terms of enabling remote interactions and even simple things like a digital payment. So the challenge of, like for instance, in the early days when we used to advise a patient, now they have to do this investigation. The patient will really want to do that investigation because they can get it done in the next 10, 15 minutes and then be done with it. But they may not have the money on them. So that would mean another visit, which not only will mean a lot of effort, but probably an extra expenditure of a few hundred rupees of going back and coming back. So that whole, this thing used to be there. And today it's non-issue. Because UPI, digital payments, all of that have not only possible, but because of the pandemic, they also had a much more accelerated adoption. So I think in this manner, I think a lot is happening now. For patient consultations, remote consultation, all of that can happen now. So these are the areas where I think there are a lot of opportunities that are now coming up in the health space.
Thank you so much, sir. Definitely, these are the trends that we do see coming up even in the news that we read, and all the things that we observe around us in the ecosystem of startup. So now we just wanted to move away a little bit from the formal questions and wanted to get to know about your life. And so basically, since you're an alumnus of IIMC, so could you share some memories that you have of your life at IIMC, the teachers who inspired you, and also the friendships that you've acquired over your time here at IIMC?
Sure. Yeah, love to talk about that. Yeah. So I'm from the 8th batch, so which means I'm the vintage from the Emerald Bower or BT Road campus. This new campus, I think, was just a dream at that point of time, being talked about, new campus and all that. I'm not even sure they had the property secured at that time. I joined IIM right after my BSc. So I was literally in my teens when I joined. I became 22 or 3 months after I joined IIM. So a lot of growing up, a lot of maturing happened right in IIM, and it was a blend of many things. I think I played a lot of volleyball, a lot of basketball. Got introduced to Mishti Dohi in Sinti More. So a lot of fond memories, and of course, in between all that, there was also a bit of management education happening as well. And it was really a lovely life, in the sense, till that point of time, the life or the education was pretty highly regulated. Like I remember when I joined IIM, I was in Ramanujam Hall. which was adjoining the classrooms and other things. You could just, you could get up at 8:55 and be in time for a 9 o'clock class. So it was literally adjoining building. And one thing that surprised me was there was absolutely no rules in the hostel. You could come anytime. There was no segregation of women's hostel and men's hostel. And I was kind of questioning, asking one of the pros, how is this that there are no rules? And I was told that, okay, you guys are going to become managers in a couple of years' time. So if you can't manage your life now, or learn to manage your life now you're not going to learn when you go to the real life. So I think just having that trust on us was very refreshing in the institute. And I'm sure, like you do now, I think we had some really great faculty that was with us. I remember several. We had this really Nobel laureate caliber economics professor, J.K. Sengupta, Jyoti Sengupta. You could just figure out that the guy knew a lot. And he was teaching us. And he already was a very distinguished professor when he was teaching us. And he came on some kind of an exchange program for a few months. And he taught a course called as econometrics, which I did as an extra course. It was not part of my this thing. I just wanted to do a course under him. And I learned so much from him. Bit of econometrics, but a lot about humility and how do you deal with people, like whatever, somebody in their 20s who knows very little economics, what kind of a question would you pose to someone like that? It'll be nothing short of something being very rudimentary or even stupid. But then he would kind of turn it around and then make a lot of sense out of the question, and then kind of respond in a way that somebody at that level also can understand and appreciate. Then we had Ramu Iyer, who later became the director. He was running MIS, which was one of my particular interest, as a subject. And later on, I did a lot of, even when I went to British Paints, I worked in systems and MIS. So he was someone that I gained a lot from and I admired. Even when I was there, he was the interim director towards the end. I think the previous person had to leave for whatever reason. And that was the placement time. And I remember I'd been to a few interviews and I would go through the second round or third round, but never got selected or never got placed. And after 4 or 5 of these attempts, I was getting really depressed. So I went and met Ramu, and I told him, I said, I'm worried that I'm not getting placed. So I think the way he dealt with me was absolutely brilliant. He said, Tulsi, you not getting placement, go to hell, no? Don't come here again. You will get placed. Don't bother me. The way he built confidence, saying that, I think if he had empathized with me or given me some advice, you should do like this, you should do like that, what he would have brought out would have been my deficiencies, sort of saying you are not there yet. No, but just brushing me aside, saying that you shouldn't worry about placement. Now you will get it. No, I think that was a huge moral booster. So we had people of that caliber. And of course, the friendships that we built there are still alive 50 years later. There are at least 10, 12 people that we interact with very closely. A few of us decided to go to the origin of Ganges and beyond. 2-3 months after we joined IIM, so the Puja holidays, 5 of us decided to make a trek to Gomukh and Tapovan and in those areas. And finally 2 of us eventually made it. And I think all those things were absolutely fantastic memories. And I'll just end with one nostalgic thing. So of course, I joined IIM after my BSc, while the rest of the class was all IITs. So in BSc, I was a topper. So when I joined IIM, I was right at the bottom. In the first few months, it became very clear. So one had to struggle really, really hard to come up. So most days we would study up to midnight and past midnight. And one of the things that we used to do was, you get hungry when you are up till that time. So we used to go next door to the Taba in the petrol bunk, and they used to serve really delicious hot tadka, roti, and whatever they had, and that became such a regular routine. So much so that our daily routine became that we stay up till midnight, whether we are studying or not, just to make the trip to the Taba. So it was really a fun time being there, and in all honesty, I think that's what has molded me to what I am today.
Yes, so thanks a lot for sharing your experience. We ourselves are experiencing this now, making memories, making new friends, connections, and also studying. So yes, that's a really interesting memory that you shared.
Yeah.
Balram says, Shubhranshu sir, you want to add something? Balram sir, you're on mute.
Fantastic. It was a lovely interview. I've always liked listening to your lectures, and this is not the first time I'm hearing about the passion with which you describe what you have been doing. It was a great interview, and as always, we are very proud of you as an IIM Calcutta alumnus, and on behalf of Center for Entrepreneurship as well as IIM Calcutta, I'm very grateful for your accepting our invitation and giving this very good interview and insights on what makes one a very good entrepreneur and also innovative. Shubhranshu, you could also.
No, I was listening, and I think there are many areas where I could see that aspiring startups and the students, they have good takeaways from whatever your journey, the way you have addressed some of the challenges,